our Tobacco 21 press conference. I'm Kathy Dre, Vice President of Advocacy for the American Lung Association in Illinois. First, I want to thank Mr. President John Cullerton, Senator Julie Morrison, and Representative Camille Lilly, sponsors of the bill, and Senator Mulrow, who's not here just yet, for being sponsors and co-sponsors, and especially for their ongoing support for our issues, including Tobacco 21. Would you like to speak now? Are you going to be able to stay, or you want to? I'd like to first release the American Lung Association State of Tobacco Control report card for Illinois. And I have it in two different versions here. You can see that Illinois did not fare too well. This is the 17th year for the report card, which measures the successes and failures of state lawmakers' actions to prevent and reduce tobacco use. The report assigns grades based on whether state laws protect Americans from the enormous toll tobacco use takes on lives and the economy. New to the report card this year is the grade for Tobacco 21, which Illinois should have received an A had former Governor Rauner signed the bill, but instead received an F. I'd like to introduce our speakers, and I'm going to have each of you introduce yourself, and I especially want you to talk about your organization and how many people your organization represents. Our first speaker is Mr. President John Cullerton.
Thank you, Kathy. And thank everybody for being here. This is really not a complicated issue. As Kathy indicated, it would be the law already if not for former Governor Rauner, because he vetoed the bill. Now with a new governor, I'm confident that we can get this public health improvement to his desk and have it signed into law. I want to particularly thank Senator Julie Morrison for doing such a great job last year in sponsoring the bill, not only sponsoring it, passing it, as well as overriding the governor's veto. We fell a few votes short in the House, and I commend her for doing such a great job again this year. I think last year at the press conference after we failed in the override, I threatened to steal the bill from her, but actually that's not necessary. I don't want to do that. I just want to help her pass it. The key issue to me has always been preventing young adults from buying cigarettes for young teenagers who then become addicted and face a lifetime of increased health problems. I also want to particularly thank the mayor of the city of Chicago for his support up in the city. He's done a phenomenal job in fighting the tobacco industry. He likes to think he's the #1 opponent of the tobacco industry in America. I think I might be right next to him on that because obviously of the harm that it does to our society, and the fact that he's been outspoken in helping urging all of us to vote for this bill. So I'm looking forward this year to passing the bill once again and not having to worry about doing an override. So thank you very much, Kathy.
Next, I'd like State Senator Julie Morrison. She's the chief Senate sponsor of Senate Bill 21.
Thank you, Kathy, and thanks to all of you for being here today. Last year, we took a huge step in passing this legislation through both the House and the Senate, and though ultimately the bill was vetoed, there has been a huge momentum behind it still in our local communities. We're now over 30 communities, and counties are adopting this ordinance on their own. Last year, over 18,000 people in Illinois died from lung and heart diseases that were directly related to smoking. And we know that last year we spent in Illinois $1.9 billion to treat people, Medicaid dollars, to treat people with those diseases. This is a preventable disease. Today, if you talk to a smoker, 9 out of 10 people who smoke today say, I started before I was 18. And so, with the 18,000 people we have dying each year in this state, I think you only need to know one to understand what the disease looks like, what it does, and how it is so preventable. For me, it was my dad who began smoking when he was 14 and died at 57, a very painful and ugly death. The local communities are behind us. Law enforcement is with us. The general public wants to see Tobacco 21, and now it's our responsibility as a General Assembly to take action. So thank you for being here today. I look forward to the passage of this and the governor's consideration of this important policy.
Thank you, Senator Morrison. Next, State Representative Camille Lilly, and she's the chief House sponsor for House Bill 345.
Thank you, Kathy. And I, too, am honored to sponsor this bill with Senator Cullerton, who's leading the charge in the House, but the faithful, durable Senator Morrison, who's just been taking this forward because she and I care about the citizens of Illinois. And I thank you all for being here today. I look forward to sponsoring HB 345. It's just that simple. 345. Tobacco 21 is important to the House of Representatives. As you may know, 36 local Tobacco 21 ordinances have been passed here in the state of Illinois, covering a population of 4.5 million Illinoisans. These local ordinances often pass unanimously. Tobacco 21 has a high support that is local. Parents, youth, organization, health industries support Tobacco 21. It is only being opposed by lobbyists who get involved with this process. And in the House, we have double the numbers than the Senate, so it's difficult to override last session. It was hard to get to that 71. But it did not mean we did not have the support. It did mean that our lobbyists had another agenda. It is important that each and every one of you understand Tobacco 21 helps ensure the wellness and health of our future, which is our youth. It is our responsibility to make sure that our youth avoid a lifetime of addiction to nicotine, tobacco, causing diseases and health issues related to those substances. We must do that collectively. So we added again. Tobacco 21 is to be passed this session. Smoking prevalent rates in Illinois vary greatly from region within our state. Chicago has a strong tobacco control law, including Tobacco 21. And this has reduced the smoking prevalence rates in Chicago. So the state should follow their lead. It is time for us to follow the lead of those counties who have said Tobacco 21, reducing increasing the age from 18 to 21 for the sale to minors or to sell to those persons under 21 prohibited. Since only home rule municipalities have the authority to pass Tobacco 21, many of these areas do have high smoking rates and prohibits from passing local T1 laws, which is reducing or increasing the age from 18 to 21. It is important that we take hold of these, I'm going to say, concerns for our society and make sure that we are passing it collectively. 2019 is the year for statewide Tobacco 21 to be passed, and I'm honored to work alongside many of these advocates, organizations, health providers, and legislators to get this done. And thank you for having us, and thank you again for being with us on this day.
Thank you, Representative Lilly. Next, I'd like to introduce State Senator John Mulrow.
Thanks, Kath. I just want to say persistence pays off. This has been a journey that was started about 4 years ago. We passed it out of the Senate, and it struggled in the House. But rather than our missteps or our struggles defeating us, we just became stronger in our commitment. It's because it makes sense. People save money by not purchasing cigarettes. Packs of cigarettes cost a lot of money, so this is going to save private dollars. It's going to save public dollars, as Senator Morrison said. With almost $2 billion in healthcare costs related to cigarettes. That's what it costs the state. And more importantly, it's going to save people's lives. The journey ends this session. I'm very proud to be a chief co-sponsor of Senate Bill 21, and I'm thankful for everyone that stands with me today as well. Thank you.
Thank you, Senator Mulrow. Next, I'd like to introduce State Senator Terry Link.
Thank you. I guess what I am is I'm the arm twister. I just want to make sure that we get this passed finally. And Senator Mulrow, 4 years is way too many years to have a wait for this. I think it's something that we have to do now. We have to make sure it's done, because not only is this cost savings, look at the amount of lives we're going to save in the state of Illinois by making sure people don't start smoking in the first place. I look forward to doing this. I will be on the Senate floor making sure that we get every vote possible, and I'd like to see 59 green lights come on with this bill. Thank you.
Thank you, Senator Link. Next, I'd like to introduce the City of Chicago Department of Public Health Commissioner Julie Morita.
Thank you. Good afternoon. I'm Dr. Julie Morita, Commissioner for the Chicago Department of Public Health, and my agency provides and supports 2.7 million people in the state of Illinois. Mayor Rahm Emanuel, my department, and I strongly support the proposed legislation to raise tobacco purchasing age to 21 throughout Illinois. I want to thank all our partners and our advocates who've championed this legislation. It takes all of us working together to make this kind of change, to improve health for everyone across the state of Illinois. And Tobacco 21 is a perfect example of what we can accomplish when we come together. Tobacco use remains the nation's leading cause of preventable disease and death. Let me repeat that. Tobacco-related diseases and death are preventable. And we have an imperative to prevent unnecessary disease and to save lives. The easiest way to reduce tobacco use is to ensure that young people never start in the first place. We're doing this in Chicago. Over the past 8 years, we've passed strong laws to make tobacco less accessible, less affordable, and less attractive. And we've dramatically reduced the number of teens and young adults who are smoking. These laws increased taxes on tobacco products, added e-cigarettes to the Clean Indoor Air Ordinance, and banned the sale of flavored tobacco around high schools. And in 2016, we raised the age of tobacco purchase to 21. Today, youth and young adult cigarette smoking in Chicago is the lowest it's ever been. And within months of Tobacco 21 implementation, the percent of 18 to 20-year-olds who reported smoking cigarettes decreased from 15.2% to 9.7%. Tobacco 21 works. However, there's still more work to be done. But due in part to the steps Chicago has taken, we're on the verge of creating a tobacco-free generation. With the proposed state legislation, Illinois has the opportunity to help children across this state, just as our colleagues in Hawaii, California, New Jersey, Maine, Massachusetts, and Oregon have done. By passing this law, Illinois will be joining this critical fight to reduce tobacco use. Most importantly, by passing this law, we can save lives of thousands, allowing Illinois children to lead healthy, tobacco-free lives. Thank you.
Thank you, Dr. Brady. I just want to add to that, if Chicago had a report card, they would have all A's. Okay, they would have an A for taxes. The city of Chicago has the highest taxes in the nation. They would have an A for smoke-free air, of course, and they would have an A for Tobacco 21. The other two grades are state-specific. Next, I'd like to introduce Paul Peterson, the president-elect of the Illinois State Medical Society.
Thanks, Kathy. Yeah, I'm Paul Peterson. I'm a general internist in Bloomington, Illinois. I have the honor to be the president-elect of the Illinois State Medical Society. We represent the more than 50,000 physicians in Illinois, And every one of us is very important, very interested in making sure that Tobacco 21 passes. This is a personal issue for me. Both of my parents died from lung cancer related to cigarette smoking. They started in their teens. And my mom, who was a nurse, wouldn't even allow us to let the lung cancer diagnosis be known because she was embarrassed that she was smoking. You know, when she was going through a cancer chemotherapy, she would go out and, I got to go out and start the car. Yeah, she was out there smoking cigarettes during that time, even then. It's really, really important for us to pass this and make sure that this goes forward. On behalf of all of the physicians in Illinois, we want to thank President Cullerton, the sponsors of this bill, both in the Senate and in the House of Representatives, and all the other stakeholders who are joining us in getting this bill passed. It's important and vital that we keep our children safe in Illinois from this incredibly preventable disease that has terrible effects on all of us. So we believe that we will get this done, and we look forward to joining you in this fight. Thank you so very much.
Thank you, Dr. Peterson. Next, I'd like to introduce Dr. Asim Jaffer from the Illinois Academy of Family Physicians.
Good afternoon, everybody. I'm very proud to be back here representing the Illinois Academy of Family Physicians on this very important issue. I'm Dr. Asim Jaffer. I'm chair of the board for the Illinois Academy of Family Physicians, and I'm a family physician in Peoria. My board colleague, Dr. Carrie-Anna Brenham from Springfield, was here last year, and we're back again this year to make sure this gets passed. Family physicians across Illinois support House Bill 345 and Senate Bill 21. 6 states have already passed Tobacco 21 legislation, so unfortunately we don't get to brag about being the first, but we absolutely do not want to wait to be amongst the last. Family physicians care for teenagers and young adults. In my hometown of Peoria, our family medicine residency clinic serves as a primary source of care for teens and particularly at-risk youth. These youth are still developing physically and emotionally, but more importantly, their brains are still developing during this crucial period of their lives. If we can guide them through their teen years and into their 20s without a nicotine addiction, the data clearly shows that it is more likely that they will never become tobacco users at all. On a personal note, I'm a father of 2 young children, Gamran and Summer, ages 10 and 7. I absolutely want to ensure that they grow up to be tobacco-free adults. These are amongst the reasons that we've been working so hard to pass Tobacco 21 legislation, and we were able to pass it successfully in Peoria last year. Taking away the temptation of tobacco can make the difference when young people are faced with these difficult choices. We have an obligation to protect our teens and young adults, to provide guidance for them, and where needed to provide laws. You've seen the numbers. E-cigarettes and especially Juuls are all around our schools and communities. Kids are getting hooked fast on the flavors and the buzz delivered in these tiny, discreet packages. Illinois has made good progress in cutting youth smoking rates, but we're certainly failing with the vaping phenomenon. By taking this very important next step with the Tobacco 21 legislation, we can help today's kids transition to be tobacco-free adults. They'll suffer fewer illnesses, have a better quality of life, and reduce their risk of deadly diseases and enjoy a healthier future. Physicians, nurses, counselors, and all providers are ready to help our young patients quit tobacco for good. It's time to take this very proven policy statewide. Family physicians support Tobacco 21, and on behalf of myself, family physicians across Illinois, and my children, we ask all our legislators to vote yes. Thank you.
Thank you, Dr. Jaffer. Next, I'd like to introduce Mark Pfister. He's the Executive Director of the Lake County Health Department and Community Health Center.
Thank you. Good afternoon. My name is Mark Pfister. I'm the Executive Director at the Lake County Health Department and Community Health Center. Today I'm also representing the Northern Illinois Public Health Consortium, the Illinois Public Health Association, and the Illinois Association of Public Health Administrators. These entities represent 97 local health departments and public health advocates from across the state who promote healthier choices, healthier people, healthier communities, and a healthier Illinois. So as Julie said, tobacco use remains the single largest preventable cause of disease and premature death in the United States. So in Lake County, we had 13 diverse communities, from Senator Morrison's home base of Deerfield to Antioch on the Wisconsin state line to Barrington and Lake Zurich, located in Lake County, and also unincorporated areas of Lake County past Local 21 ordinances. So it's been a very nonpartisan process. So why did they and why did we support raising the minimum legal sales age to 21 in Lake County? And it's simple. It's to support our young adults in making healthier choices. So we thank all our advocates and other supporters that have worked on this. 2019 is the year that we're going to pass Tobacco 21 in the state of Illinois. Thank you.
Thank you, Mark. I want other people to identify themselves, please.
Matt Maloney from the Respiratory Health Association.
I'm Sean McDermott. I represent the Illinois chapter of the American Academy of Pediatrics, representing over 2,000 pediatricians throughout the state of Illinois.
And I'm Scott Sachs. I'm the chair of the Illinois Advocacy Committee of the American Heart Association.
Any last words? We're available to take questions if you're interested.
Do you have a count of exactly how many local ordinances have passed Tobacco 21 in the state?
There's 36.
36,
Mhm.
okay.
They cover about 4.5 million population.
And then,
I think there's a list in your packet, too.
yeah, just because I think the packet says 34.
And then at the bottom it says Cook County passed. Well, there must be one missing off of there, though, but it's 36.
Okay.
Maybe it's unincorporated Lake County,
Okay,
so it may just be the municipalities.
gotcha. And then I just had one other question for you. I think I asked you yesterday on the phone.
Okay.
The Representative Butler, who's the co-sponsor in the House, wants to, as he said, add teeth to the measure, sort of add back some version of the language that was taken out, that would add like a punishment almost for any minor that was, smoking cigarettes, much like any minor that's caught drinking alcohol faces some sort of punishment. Do you have a response?
Actually, ticketing kids for tobacco use or for tobacco possession is a tobacco industry tactic. Our organizations do not support criminalizing kids for possessing tobacco. We just feel like the adults who are selling the product and who are making a profit from it should be held responsible, not the kids.
So you're not up for compromising, that's kind of the
We certainly would like to hear what he has to say. That's definitely, we definitely want to see what his ideas are, but probably, right now, we want to leave the language the same. Any other questions?
What have you heard from the governor's office?
We haven't had a chance yet to sit down with the governor, but we hope to soon. But everything that we've heard so far has been very positive, and we have been notified that the Illinois Department of Public Health is going to slip the bill in support.
Besides Tobacco 21, Illinois also got several other failing grades on that report card.
Yes.
What measures do you see the state that need to take to raise this grade?
We'll continue to work on that report card, yes. This year, our priority is Tobacco 21, though. Mhm.
But what can Illinois do to kind of raise the grades in other areas, though?
Well, the funding issue, right now, a very small amount of the tobacco settlement funds are actually dedicated to tobacco prevention and control, about $9 million. And certainly, that figure could be raised. Most of that money goes to the local health departments. Mark, would you want to talk about that, what the health departments do with that money? They help people quit smoking
Yes,
and...
Sure. So, actually, much of this campaign in Lake County has been supported by the tobacco settlement funds. So they've been out working, providing technical assistance to all the different communities to assure that they have appropriate facts and knowledge of the issue. But we also do other types of media prevention, so just to inform students and other adults as to the hazards of smoking. So that's really, a lot of it is prevention education, technical assistance, just to assure that people understand that tobacco really has no viable benefit to any human being.
What are concerns about if Tobacco 21 is passed about those 18-year-olds going just across the border to a different state and like purchasing?
Would you like to address, you want to address that? Yeah.
So what we know is that young people don't necessarily don't have the ability to travel as far as adults do. And we also know that young people also tend to purchase, if you're underage, you're more likely to purchase it from somebody who's closer in age to you, who is legal to purchase. And so part of the goal with Tobacco 21 is to make the tobacco products less accessible to younger kids, middle-aged kids, because they're interacting with the 18-year-olds. They're not necessarily interacting with 21-year-olds. And so by limiting the age and increasing it to 21, those kids, those young folks, the middle school kids, high school kids, are less likely to access it because their peers, who are more likely to be 18 to 20 than 21 and older, those folks just can't get access to the tobacco products, so it's not a concern.
And two of our communities that have passed Tobacco 21 are border towns, so Antioch and Winthrop Harbor, and so actually they're right on the Wisconsin border. But Wisconsin actually taxes tobacco products at a higher rate. But to Julie's statement is that these younger individuals are not traveling long distances to purchase their tobacco products. In fact, the Illinois Youth Survey came out and showed that the majority of the tobacco products that are getting into those under the age of 18 were purchased by those that were 18 years of age.
So at 18, you don't trust me to make a good decision on cigarettes, but you do trust me to enter in a contract to marry my soulmate, Lee Milner, or even to cast a vote for John Mulrow. How do I reconcile those two?
So I think one of the things to keep in mind is that the impact of nicotine on young people is more dramatic, and so the brain is still developing into young adulthood. And so addiction to nicotine occurs much more easily when you're younger, and so the goal is really to not have people exposed to the nicotine to get addicted until they're older and less likely to become addicted. It also affects and impairs their brain development, so we don't want them even exposed to the nicotine to begin with. So it's a matter of really protecting these folks' brain development, their addiction potential. And if you talk to smokers, as it was said previously, 9 of 10 current smokers started before the age of 18 and wish that they had not started. So I think this is something we have to keep in mind as we consider this legislation, and really it should be a motivating factor for us, is to prevent this next generation from becoming addicted.
Now, if I were to go home and on my way stop at the White Hen and get a Mountain Dew with pure cane sugar and a bag of cheese doodles and some Twinkies, are any of you folks going to be in line and try to stop me from doing that next?
Anybody else want to? I think, you're talking about things that you can use in moderation. And tobacco, you really cannot use in moderation. Any exposure to tobacco is dangerous to us, so.
You haven't seen me shop.
You said a Mountain Dew and a package of cheese doodles.
Oh, yeah, very good.
I think maybe we're all guilty of those kinds of occasional pleasures, right?
Moderation's not me.
Medically is like, because the age to buy alcohol is 21, is raising age to tobacco 21 kind of similar with your brain? Is comparable, yeah. Does it affect your brain? I know that wasn't a coherent question, but medically, does alcohol and tobacco sort of affect your brain in a similar manner?
Definitely.
I can comment on this, if it's okay. So it's a fair question. I would say that the age of adolescent age, young adults, teens, early 20s is still a very important time for the development, for the brain development. And so if you're asking, does alcohol and tobacco, do they affect the brain the same? They do not. I'm going to certainly say that both of them will negatively affect the brain, but in different ways, different pathways. And as far as the question about the sugar-sweetened beverages and the unhealthy foods, any visit with your physician, with your primary care physician, certainly you're going to get some feedback about those choices, because we do know that those are unhealthy. But I will also say that any type of tobacco use is a type of tobacco abuse, because there's really no benefit to tobacco use. whereas nutritionally, some of the other foods are maybe something.
Any further questions? Anybody want to make any further comments or anything?
You had mentioned the master settlement agreement money.
Yes.
From folks I've talked to on this, the state could be using a lot more of that money for things like tobacco
Right.
cessation programs. This may be a question more for Senator Morrow, but considering the language of the master settlement agreement doesn't require states to dedicate any certain amount, a set amount to that.
Right.
What's the legislative likelihood that the state would want to dedicate any more money to tobacco cessation when they need all the money they can get for the budget?
Right, and we've spent years advocating for more money for tobacco prevention cessation, and, 55% of the Illinois payment is securitized every year, so, it's a hard issue. It is a hard issue when Illinois has so many funding problems, so. But I think that the health departments do a very good job with the funding that they do get. The Illinois Tobacco Quit Line is also funded by the Master Settlement Agreement, they could definitely use more money, especially for advertising. If you have a quit line that people don't know about, that's not very helpful. When the CDC runs their ads, you've all seen the tips from former smokers ads on TV. All of those calls go to the Illinois Tobacco Quit Line if they were initiated in Illinois. And that helps with the advertising, but you could always use more funds for advertising and for counselors and things like that. So I think that what Illinois does with that $9 million is significant, and it's very helpful with reduction of tobacco use in Illinois, but we definitely could use more. Are you taking notes? Anybody else? I did want to kind of clarify one thing about the home rule versus non-home rule. Non-home rule communities cannot pass. They do not have the authority to pass Tobacco 21 in Illinois. And there are 1,298 municipalities in Illinois, and only 209 of them are home rule communities. And that is why we need to have a statewide Tobacco 21 law. So, over 1,000 communities cannot pass it. And many of those communities are down in downstate Illinois, where the tobacco smoking prevalence rates are very high. Many of the downstate counties are twice the rate of the city of Chicago. The city of Chicago has done an excellent job with reducing tobacco use through the laws that they have passed. So, any other questions? Or anybody need any clarification? Thank you very much.